Okay, so the next one is skin patches. So these are just a strip-like thing that will be attached onto the skin. So it will be released onto the skin epidermally. So remember, drugs are given in different ways. One is oral, that means through tablets, syrups. Okay. Second, or sublingual as well. That means under the tongue. So the medicine or drug kept under the tongue. Next one, IV, intravenous. That means directly we are giving into the veins. When we give through IV, the drug will be absorbed into the blood very quickly. And the third one is IM, intramuscular. So where you are giving the drug to the muscular tissue, where the muscles are present. So you can say the buttock region, okay, or upper arm. And the fourth one is subcutaneously or epidermally. That means you are giving like a patches onto the skin, or you are giving the drug directly into the epidermis, okay, epidermal layer or subcutaneous layer. So why we give IV is like when you want to take the action of the drug very quickly. So we suggest IV. If it is IM intramuscular, where the blood vessels was capillaries were richly supplied. So when you give into IM, it will slowly absorb into the capillaries and drug action will take place. At least it takes some 30 minutes. Whereas if the drug is given orally, so what happened? It will go to the stomach or it will go to the intestine. It will either absorb from the stomach or from the small intestine, and then it will go to the liver. So whatever that comes to the stomach or intestine, first it has to go to the liver. So once it has to go to the liver will metabolize the drug and it will release the actual active drug ingredient into the blood. So drug action will take. So it takes a long time. At least it takes more than 1 hour for the tablet to take action. But IV, it just takes in seconds. IM, it will take at least 20 to 30 minutes. Subcutaneously, it will be like 40-45 minutes. And it takes place very slowly. The total concentration will not achieve at a single time. So first you are giving into subcutaneous where the capillaries are present. Slowly the drug will move from the skin tissue to capillaries. So the concentration will gradually increase over a time. So here the skin patches where it has to cross through the epidermal layer, and inside that you have the capillaries where the drug has to absorb into the capillary. So same, the drug is estrogen, progesterone combination will take. So these patches slowly keep releasing the hormone. Okay, you understood why? Because first it has to cross through the epidermal layers subcutaneously, and then it need to enter into the blood capillaries. For that, it takes time. And not gradually you will get the concentration I. First, suppose you take IV or IM, so the concentration will just go very high or optimum concentration in a very small amount of time. IV is like just you are directly inserting into the blood. So the concentration or full concentration will reach in seconds. But subcutaneously, where the concentration will gradually increase and it takes time for that. But there's a disadvantage that in rare case it can fall off. Okay, so one should has to take care whether it is there or not. One should be mindful about it. How to use? Just attach that to the skin. Okay, either it can be upper torso, outer arm, abdomen, or buttock region, and the efficiency would be 99%. Okay, and could replace after every 28 days. So that's about the skin patches. So remember this one. So it slowly keep releasing the hormone into the blood through skin. The drug concentration will reach very slowly. Actually, the drug concentration will be like this. So there is a concentration of drug where the drug action will not be showed, and then it will reach to the threshold level where the actual concentration will start acting on. Okay, so this we call it as threshold level or minimal effective concentration. So minimum effective concentration. So when the drug is just below the minimum effective concentration, will not get the action of the drug. Then there is no use of the drug at all. And there will be maximum effective concentration. Maximum effective concentration. So this is the concentration where it is up to safe level. That means after minimal effective concentration level, so the drug starts showing its action, but it up to maximum effective concentration. If you give more than that concentration, then it will lead to toxic level. That means if you give more than the maximum effective concentration, the drug will now become like a toxic. So that will shows very adverse drug reactions, adverse effects. Okay, so this is the window or drug window where it will be safe. You can also call it a safe window of the drug. So minimum, so that it will show action, and maximum, so it will not cause any toxicity. But if you go beyond it, it will show the toxic levels. Okay, so this is the minimum effective concentration where drug will show the action, and this is the maximum effective concentration where the toxic levels of drug is very minimum. But if the drug concentration reaches more than this, it becomes very toxic level that it will harm the patient. So we should give this safe window where the action of the drug is effective and it will also show least side effect, least toxicity. This is the safe drug concentration. So to reach this concentration, if it is IV, it will just reach very less duration, like in 5 minutes, the drug, or it's even in 1 minute. Okay, the drug concentration will reach to the effective concentration level. But if you take skin patches, so they reach to the minimum effective concentration, at least it takes some 30 minutes or 40 minutes, and then it will maintain that concentration level up to long term. So it will show the long acting release. So that's what here. So slowly keep releasing the hormone in the bloodstream and it will maintain for longer duration. So remember, IV is like it will keep only shorter window. That means it will be effective. It will start acting within 1 or 2 minutes and the concentration will maintain in the blood up to 1 hour or 2 hours or 3 hours based on different types of drugs. Okay. So remember this thing. This is all not needed, just I'm telling you. Okay. So how these skin patches will work. So it is a next one. So vaginal rings. These are the small, flexible, soft plastic rings that are that are kept in the female reproductive. So in the vagina. Okay. So these were squeezed and inserted into the vagina. So remember that they contain the drug estrogen and progesterone combination. Okay. So it has a 99% efficiency, but there is a drawback that if it is not inserted, okay, so it can be expelled out. And remember, we know the female vagina and cervix will be up to, so like say some 10 to 12 centimeters. Okay. So this has to be inserted so that it will not, okay, cause any problem for the intercourse. So usually the penis can penetrate up to 5 centimeters or 6 centimeters. So it should be inserted beyond that, or you can say above 8 centimeters, like that, 7 to 8 centimeters, so that it will not cause any effect during the intercourse. And it should not hinder the sexual pressure as well. That region is up to 1/3 of the vagina. That means the first 2-3 centimeters where the sensory nerves are abundantly present. So it will not hinder pleasure as well. Okay. So user of vaginal ring report common problem that feeling uncomfort on using them because they has to insert very deep. Okay. And the efficiency is 99%. So what are these common drawbacks of these hormonal chemical contraceptives? One is irregular periods. Okay. Due to the hormonal imbalance, mood changes. Okay. There will be a lot of mood swings. It can cause the depression because low estrogen levels will cause the depression. Weight gain, sore breast. Okay. So these are the common side effects. There will be vaginal irritation, or sometimes it can cause the inflammation as well because we are inserting the foreign particle into it. So our immunity will respond to that. So there will be chance for inflammation to happen. So it will prevent the pregnancy, but there's a chance for sexual transmit diseases, and they can cause low sexual drive due to the less estrogen levels in the blood. If it's for males, the testosterones we use, so there will be low sexual drive. And there's a common cause like migraine and vomitings. Nausea means vomitings. Okay, the feeling of vomiting. We discussed so far the hormonal. Now let's see the non-hormonal contraceptives. So the first one is Saheli. So Saheli, remember, this is a non-hormonal contraceptive. Remember, this is very important. Saheli is a non-hormonal contraceptive. So yeah, Saheli, it's a non-hormonal, but where does it act? It acts on the estrogen. So where the estrogen has to bind, it will bind on those receptors instead of estrogen. It will mimic the estrogen act. So in that receptor, our hormone estrogen will bind it. So when it bind it, it will show the estrogen activity. So the receptor will respond to the estrogen and it will show the effects. Okay. But here, instead of estrogen, our drug or meloxifene or cancroman will bind here. So that estrogen cannot bind it. But it will show certain activities where estrogen has to show. Okay. So remember, it will just modify the estrogen receptors. Okay. By binding to that. So this drug taken once per week. So remember, it is a selective estrogen receptors modulator. And how does the estrogen will helpful for preventing the pregnancy? I told you on the other day.
It maintains normal thickening of the uterine wall.
Yeah. So it will maintain normal thickening of the uterine wall, right? So due to this, instead of attaching the estrogen, this will attach and this will prevent the implantation. So remember, Saheli will helpful for preventing the implantation by blocking estrogen receptors. So either we give estrogen so that the estrogen will do the activity, or else we are giving these Saheli drugs so that they also mimic the estrogen function or estrogen activity by blocking the remember. Okay, so they will just maintain the normal thickening of the endometrium so that implantation cannot take place. So these are only oral non-steroidal contraceptive pill. Remember this, very very important. These are only oral non-steroidal contraceptive pill. That means they are non-hormonal and they are taken orally. Remaining all are taken vaginally. That means inserted into the vagina. Okay. So or through other ways like giving into the injection form or patches form through other means. Okay. But this is the only drug which is non-hormonal and given through oral. And this is available in different trade names. So Novex, DS, Centron, Sevista, Saheli. Okay. Or you can also call it is available in the form of Chaya in India. Remember, Chaya. It is nothing but Saheli drug. Okay. That is marketed in Indian under the name brand name called Chaya. Okay. And which who has developed this? It was developed by Central Drug Research Institute. Remember, and this is available from the 1990s. Okay, so before independence. So remember, this point is very important. Only oral non-steroidal contraceptive pill, Chaya in India, and it was developed by Central Drug Research Institute (CDRI) in the year 1990s. Okay, and it is taken once per week. So these things you need to remember. So it will prevent the implantation. What's the mechanism of action? Preventing the implantation by blocking estrogen receptors. Okay, by maintaining normal thickening of the endometrium, okay, or uterus wall. So see this one, or the Saheli pill, okay. So it doesn't affect the hormonal cycle, but instead it modifies the estrogen receptor on the wall of the uterus, okay. So the modified receptor doesn't accept the estrogen hormone, so no thickening of the uterine wall takes place, no implantation occurs, okay. So that means it will not affect all this. So GnRH that will stimulate the anterior pituitary, releasing FSH, LH. So all this hormonal cycle, it will not hinder. Okay, it will directly act on the estrogen receptors that are present in the uterine wall and make those make the endometrium couldn't take place implantation. Okay, so that implantation cannot occur. So how to use this drug? It was taken once a week. Remember this one. Okay, so it is taken once a week pill. Okay, so initially at the beginning or the when the female start using this drug, okay. So initially for first 3 months it is given twice a day. Okay, sorry, twice a week. Okay, on Mondays and Tuesdays. So once after 3 months, once effective concentration has reached, so now once a week is given. So you can call this as a loading dose. So the dose which is given to maintain the optimal concentration. And then you can maintain this loading dose by giving just once a pill every week. So initially 2 pills were given for first 3 months in a week. Next, only one pill is followed every week. So remember that one. Okay. So 2 pills are taken in a week. Okay. For the first initial 3 months. And after that, it will be continued with single pill in a week. Okay. So either if the patient is taken on the Monday, so the other pill will be on the Thursday. Okay. After that, it is followed with one pill in a week. Okay. What are the drawbacks? The weight gain, nausea, and vomiting. So these are the common drawbacks for every drug. Okay. So weight gain, nausea, vomiting. So remember, these are side effects you remember or drawbacks. You need to write for the, I mean, for theoretical exam, you need to write these things. So weight gain, nausea, vomiting, these are the common things. Efficiency is 99%. Next one is formulation. Remember, formulation word means it's always certain creams, jellies, foam, okay, that are applied. We call it as formulation. Okay. So tablet form and then formulation. Formulation is like a creams or ointments or jellies or even foams that are applied externally. So how does this work? So it contains the spermicide, so kills the sperms, blocking the cervix and entry the uterus by forming a plug, mucus plug, or slowing down the sperm movement. So sperm mobility is decreased. So it cannot reach to the uterus or to the fallopian tube where fertilization is prevented. Okay. So what are the drawbacks? It will not protect through STDs. Remember, these are all will not be protecting any STDs. Okay. So only barriers will protect from the STDs. Okay. So whatever the chemical contraceptives we are using, they will not protect the STDs, protect from STDs. Okay. And it is affected for a limited time period. So like it will maintain the up to 3 hours. So every 3 hours you have to use. Okay. So vaginal irritation and infection can cause, because some are showing the you can say allergy to these formulations. Okay. So it can cause irritation and infection in those patients, those who are having allergies. So how to use? Apply deep in the vagina, okay, or into the cervix, just 10 to 60 minutes before the sex, okay. And it should not be washed out after the sex. It has to kept for 5 to 6 hours. But I said this can only maintain up to 3 hours. So every 3 hours you need to apply for the next 5 to 6 hours, so that there will be no chance for the sperm to enter into the uterus. Okay. So it is not recommended to use alone. So best effective with other barrier methods. Okay. The efficiency can be, if used alone, 20 to 25%. So efficiency in combination with other barriers, you can use 99%. That means using the condoms as well and these formulations. So both the spermicide activity as well as barriers. So will give complete protection. If the barriers let the chance of sperms entry, these spermicide will kill those sperms. So in combination with other barrier methods. So in summary, so pills, injection, implants, skin patches, vaginal rings, contraceptives, all these are hormonal. Okay. So where they are used, females or males. Okay. And it's a short term, long term effect. See, in males also, the function will be like same. Okay. They will be block the hypothalamus. So it will not stimulate the anterior pituitary, and that will not helpful for production of FSH and LH. So there will be no testosterone hormones, there will be no androgens, there will be no production of sperms can happen. Okay. And all these are reversible. Remember this one. Okay. And only implant is the long term duration, remaining all the short term durations. Okay. Is that clear?
Yes, sir.
Okay.
Yes, sir.
So we have studied barriers, chemical contraceptives, and we also studied the natural way. So we'll study intrauterine devices or IUDs. Okay. So these are small birth control devices that are inserted into the uterus to prevent the pregnancy. And they will be helpful for long acting reversible contraception. Once the devices were removed from the uterus, the female can have a chance for getting the pregnancy back again. So what is the mechanism? So this works by phagocytosis. So what is phagocytosis? What is the word phagocytosis?
Is there engulfing?
Cells will engulf it and digest the sperms within the uterus. Okay. So there are copper ions release suppress the sperm motility. So one is that way. Okay. And fertilizing capacity of the sperms will decrease. The second one is, so first one is by phagocytosis. Second one is, so whatever these copper devices are there, it will decrease the sperm capacity to fertilize the ovum. Okay. So these were inserted into the endometrium that will cause the unfavorable conditions for implantation. That is the third one. Okay. So first one is phagocytosis of sperm, make the sperm ineffective for fertilization. Third one is, if fertilization has happened, it will prevent the implantation. So that's the third one. Okay. Some are hormonal. Okay. So that means they will release the hormones. So that will make the uterus unsuitable for implantation. That means which hormone it is?
Estrogen.
Yeah, estrogen. Some will be progesterone as well. How does it act? Okay, it will show the negative feedback mechanism that will prevent the hypothalamus in releasing which hormone?
Also it will stop ovulation.
Yeah, it will prevent the GnRH that will prevent the anterior pituitary to release FSH and LH. So when there is no FSH and LH, the anterior pituitary cannot stimulate the ovary in order to make the or maturation of eggs. So maturation of eggs cannot happen. So egg release is prevented. So one is that way. Second one is, whatever the matured eggs are there, they cannot release. So ovulation. And the third way is preventing the implantation. So one is mature eggs cannot be formed. That means follicles will not mature. Ovulation will not happen. Implantation will not happen. So what are the different ways the IUDs will work? One is it acts like a phagocytosis. Second one is it will make the sperm ineffective for fertilizing the ova. Third one is by decreasing its mobility. Third method is it will make the endometrium unfavorable for implantation. And the fourth method is they act like a hormonal contraceptives. Okay. One is progesterone, the other one is estrogen. Okay. So these are the different methods where IUDs will act. Okay. So based on that, we have different types of IUDs as well. And it is the most widely accepted method of contraception in India. Remember this thing. Okay. So IUDs is most widely accepted method for contraception. So what are the different IUDs we have? One is non-medicated IUDs, copper releasing IUDs, hormonal IUD. As we talked about 5 different ways the IUDs act. So these are the how they classified. One is non-medicated. Let's see how it is. So the first one is lipase loop. So lipase loop, it's a double S-shaped inert flexible plastic loop. You can see here in the image. So double S-shaped plastic loop. Okay. Or you can also call it as the trapezoid shape. Shape is not important, but remember this is okay. It is a S-shaped inert flexible plastic loop. Okay. You can also call it as lipase loop. So it is a non-medicated, but how does it will helpful for body have a contraception? So what it will do is it's a foreign material. And when this foreign material is inserted into the uterus, what happens? Our immunity will be triggered. So when a foreign particle enters into our body, what happens? Our immunity will be triggered. Hey there, let's go there. There's someone foreign entered into our body. We need to protect our body from that. So all the immune cells, okay, all the immune cells will reach here. Once they reach here, there is a high number of immune cells are present. Okay. At that time, the sperms, if they enter, all these immune cells will destroy the sperms because sperms are also foreign materials that entered into the female reproductive tract. So they will kill all the sperms by the mechanism phagocytosis. That means they will treat this sperm like a foreign particle and they start eating these sperms. So in order to trigger that immunity, so we are inserting this lipase loop into the female reproductive tract, into the female uterus, so that the female reproductive tract now it is more susceptible to the immunity and that will attract all the immune cells there. Once all the immune cells are present more, if the sperms enter there, they will kill all the sperm cells. So when there is no sperm cells, phagocytosis when it happened, there is a less chance for fertilization to happen, to reach to the egg. Okay. So it is not having any medications, it is not having any hormones, any drugs, nothing is present. Just it is making our body so that our body will attack all the sperms. So how to use it? So the doctor or trained nurse will insert that, okay, and it will be put into the uterine lining where there is a number of folds are present. The uterine lining will be having several folds inside. So they will be inserted somewhere in that. So what are the drawbacks for this? Expulsion of the IUD, bleeding and pain, pelvic inflammation. So these are the side effects you can see or drawbacks you can see by using these lipase loop. Next one is the CU releasing CUT, CU7, multi-load 375. Remember that. Okay. So it's just a plastic frame wrapped with a copper wire. Okay. So why copper wire? We'll see. So remember the CUT, T is nothing but it is a T-shaped. Okay. A 7, TU7 or CU7. CU7 is nothing but it is a 7-shaped. Okay. And 375. So 375 is nothing but a number. Okay. It's a 375 millimeters of copper is wrapped. You can see here. So this is the 375 of copper that is wrapped around this stem. Okay. So that's what 375 means. So CU7 as it is 7-shaped, CUT as it is a T-shaped, multi-load 375 as the copper is wrapped almost 375 Okay. There is a 380 as well. So remember that. Okay. That means 380 copper is wrapped around this stem. So how does this device work? So this works, see copper. So these devices will release copper ions. So when the copper ions are released, they will decrease the sperm mobility. So sperm cannot move. So that it will not move up to the reproductive tract. Up to the fallopian tube and fertilization cannot happen. So one is that. Next one is it will disrupt the implantation of embryo. Okay, it will prevent the embryo to implant in the female uterus. So that's how it can also avoid acts like a contraception. So the major work is sperm motility. Okay, they will weaken the sperm. They will make the sperm ineffective to fertilize the egg. They cannot move up to the fallopian tube. Okay, so that's how the Cu ions will act, which are releasing from CUT, Cu7 or multiload 375. So the copper ions will immobilize the sperms. So sperms cannot swim up to the fallopian tube, reach the egg for fertilization to happen. So that's how these drugs work. These devices works by releasing copper ions. It was inserted by the trained doctors or trained nurses. So it's a plastic arm, helps the IUD sit between the folds of the uterus lining. So they will be flexible at that. What are the drawbacks? Cramping, pelvic inflammation. So remember, inflammation means swelling, expulsion from the uterus. As the contraction happens, so they will expel this device out of the female uterus. So perforation into the uterus walls. So they can put some holes, or they can also trigger the cells to perforate. Okay. And heavier periods can happen because of a lot of cramping contractions of the female uterus muscles. There's a chance for heavier periods or blood loss. So efficiency is up to 97%. Because by miss, if any sperm is left over, and it can have a chance to fertilize with the ova. So remember, copper releasing IUD multi-load 375. Here 375 means that 375 millimeters of copper wire just wrapped around this stem. Okay. And the multi-load 375T, copper 380 are similar in their efficacy and performance. So there's no difference in their efficiencies. And the next one is progesterate LNG20. Okay, tell me what is LNG that we discussed yesterday? I mean, last class on Saturday. What is LNG? See, progesterone is something that is available naturally in our body, right? Then what is LNG? Come on, guys. What is LNG? How we are sensitizing this progesterone? Artificially. So we call this as a synthetic.
Is it a form of progesterone?
Yeah. Okay. So it's nothing but a synthetic progestin or progestogen. So what is LNG? It is a levonorgestrel. Okay. So LNG means, remember this word, levonorgestrel. It is nothing but a synthetic progestin, or you can also call it as progestogen. See, here I use the word progestin or progestogen instead of progesterone. See, whatever that is available in the female, it is a progesterone. This is a natural hormone. But we are making a hormone synthetically. So we call that hormone as a progestin or progesterone. Okay. So which will be having same effects like the natural hormone progesterone. So remember, progestin or progestogen, the ends, the suffix you see here. So these are synthetic ones. Progesterone is a natural one. So here, these will act same like a progesterone. Okay. So remember that one. So levonorgestrel is nothing but a synthetic progestin or progestogen. So write down this one. Okay. So what is LNG? It's a synthetic progestogen. So now these IUDs, they contain here a well-like structure where the progesterone hormone is present. Okay, progestogen or progestin or LNG is present here. Okay. You guys wrote this. Levonorgestrel. It is a synthetic progestin or progestogen. Remember, this will be having the same or similar effects to the progesterone. Okay, so whatever the effects are there for the progesterone, the similar effects are shown by this progestin or progestogen hormone. Okay, these are synthetic ones. Okay, so they were named as levonorgestrel. And remember this one, progesterate lasts only for an year. This one, whereas LNG20, it can last up to 5 years. Okay, they are inserted into the female uterus. So one is copper, the next one is hormonal devices, which will be releasing hormones, progesterone. And we know how this progestogen will act. So the same effect like the progesterone. So it will act on the hypothalamus. Inhibit the GnRH. So there will be no LH, no FSH, no ovulation will happen. So that's how it will act. Okay. So remember, whatever the progesterone hormone or progestogen hormone is there in that, so that will be released sustainably for a longer duration up to 1 year or 5 years if it is LNG20. Okay. And slowly this hormone will prevent the GnRH to release. Okay. Prevent GnRH release from the hypothalamus. So when there is no GnRH, no LH, no FSH, no ovulation can happen. So release levonorgestrel, a progesterone synthetic hormone similar to progesterone, okay, which will thicken the cervical mucus. So one is thickening the cervical mucus so that it will form a plug-like structure, prevents the sperm to entry into the uterus. Second one is it will prevent the ovulation. Third one is it will last about 5 years. Okay, so remember this one. It will also cause implantation cannot occur. Okay, because this will entirely prevent the hypothalamus to release. Okay, so there will be no anterior pituitary, no FSH, no LH, even estrogen cannot produce. Okay, so that will maintain the normal thickening. So when there is a normal thickening, what happens? Implantation cannot happen, right? So how to use? A doctor or trained nurse will insert into that. Efficiency is 99%. Okay, so what are the drawbacks that you can see? So weight gain, ovarian cysts, so that can cause PCOD, affects mental health, nausea, headache, migraines, lower sexual drive because of low amount of estrogen. So which of the following is a hormone releasing IUD? Which of them are hormonal releasing IUDs? Just now I told you. So something that is releasing levonorgestrel. So what is the option here? LNZ20. Yes or no? It is the one which
Yes, sir.
releases the levonorgestrel. And how many years will it act? 1 year or 5 years?
5 years.
I told you two. What is that? One is LNG20. What is the other one? Progester cert. Okay. So here, this one will act only up to 1 year, whereas LNG20 will act up to 5 years. So remember, okay. So remember, which is a hormone releasing IUD? LNG20. What about lipis loop CU7 multi-load 375? Tell me what is multi-load 375? I told you what is this number also. 375 means what? The copper wire of 375 millimeters wrapped around the stem. So this is a copper device. Lipis loop. Does it having a copper? Come on, guys, are you following me at least? Gauri, tell me what is a Lipis loop? What is the mechanism behind Lipis loop?
So it's made of plastic.
Okay.
Um,
So what's the
most-
mechanism?
Sir, it closes near the uterine cavity, right?
All these are inserted into the uterine cavity. That's why they are called as
I mean,
intrauterine devices.
I mean,
I told you.
Once it's inserted inside the uterine cavity, our body immune cells will attack on it, and hence it will kill the sperms too.
Yeah. Okay. So it's a foreign material that is inserted into the uterus that provokes the increase of the immune cells. So when the immune cells are present abundantly, they will kill all the sperms. They will show the phagocytosis and they will prevent the fertilization to happen when there is no sperms, when they are killed by immune cells of the female reproduction. Sorry, female. So what happens? There's no sperms, no reproduction, nothing can happen. Okay, no fertilization. What about CU7? It's also a copper device. What does the copper will do? So release of copper ion, what does it do? So this one is phagocytosis. So it is not having any medicine, not even a copper, not even a hormones. So LNG20 is having hormones. Which hormone?
synthetic progesterone.
Levonorgestrel. Okay, synthetic progesterone. Whereas a multi-load 375, it is having copper ions. So what does the copper ions will do? Immobilize the sperms, prevent the motility of the sperms. So sperms are becomes ineffective. They cannot swim up to the fallopian tube. It cannot prevent. It prevents the fertilization. The same with the copper 7, as it is having 7 shape. 375, as 375 millimeters of copper wire is wrapped around the stem. Lipis loop. It is just a device that triggers the immunity in the female reproductive tract so that all the immune cells will accumulate in the uterus and will kill the sperms, as the sperms are also foreign material. They are also foreign bodies. Okay. So yeah, we are trying to prevent the contraception, but failure of contraception, what could be the reason? One is broken condom, so that there's a leakage of the semen, so sperms can leak into the female tract. Missed pills, if the woman is failed to take the pills all the day, even a one pill will decrease the efficiency. That day we talked from 99, it will decrease to 90%. What if a woman is absent to take for more than 1 day, 2 days, 3 days? Next one is expulsions. So whatever the IUDs are placed into the uterus will try to expel it out. So if the device is expelled out, there can be a chance for pregnancy happen. Patch falling off. So whatever the patch that are inserted onto the skin, if the woman is not mindful, it can fall off and it cannot prevent the pregnancy. Next one is expired condoms. So that the condoms can be broken or they can tear and they cannot be prevention of the pregnancy. Okay. So failure of contraception, risk of pregnancy. So once the woman is trying to prevent the fertilization to happen, but what if the fertilization happened? So what's the next thing? So that's a plan B. Okay. So remember, that's the reason why these eye pills are called as the plan B. So plan A is to prevent the fertilization to happen. The plan B is, if through somehow fertilization happened, then we need to prevent that fertilization. So whatever the fertilized zygote is formed, that is implanted and turned into embryo, or embryo implant onto the uterus. So that's a plan B. Okay. So emergency contraception refers to the method of contraception that prevent pregnancy after sexual intercourse. Okay. So, or you can say unprotected sex. So emergency contraceptive pills are medical formulating containing levonorgestrel, that is a synthetic progestogen or progestin, which is having similar effects to progesterone. Okay. So example, you can say I pill or Plan B. So these are the different names. So these are given after just before 3 days of the intercourse. So they are only effective if you are taken just before 3 days. Okay. Or you can also call it as morning after pills. That means, yeah. So 72 hours. So these are only could act if the female has taken before 3 days of the after the sex happened. Okay. Unprotected sex happened. So these are used in cases of if there's a chance the to prevent the pregnancy that's happened due to the rape or unprotected intercourse or missed pills. Okay. So it is a medical formulation containing levonorgestrel. Okay. So that can delay or prevent the ovulation, or that can thicken the cervical mucus. So semen cannot uterus. So ovulation happened, mucus was thickened, but still the sperms has reached into the uterus and into the fallopian tube. Fertilization happened. Then prevent implantation of the embryo. Okay. So pill should be taken within the 5 days of the sexual intercourse, or more effective when taken 3 days before, 3 days after the sex. I mean, within the 3 days after the sex. Okay. So best used after unprotected sex or rape. Okay. So no long-term or serious side effects, but there will be short-term side effects like headache, abdominal pain, changes in the period schedule, feeling sick. Okay. The efficiency is 95%. If still the levonorgestrel couldn't able to do, then we'll be taking help of other drug called mifepristone. Okay. So this is the last and final chance to prevent pregnancy. Or you can also say these are the abortion pills. The pills that are given to abort the pregnancy. Before all, they are just preventing the embryo or just fertilized zygote. But this is the one which is killing the embryo itself. The embryo which was well developed. So it is affected during the first 50 days of pregnancy. After 50 days, if still the woman is taking this, what happened at that time? The embryo was well developed. So it will be formed into a good structure. And if the woman is taken these drugs, so the body try to expel this living embryo. So some part of the embryo will be gone out due to the heavy contractions of the female uterus, but there will be some left masses can be there in the female uterus. So those masses can lead to infections or even can cause cancers as well. So that's the reason why if the women who are taking these after 2 months or 3 months, so some part of the embryo can be expelled out, but some part will be left over and that can cause the infections to happen. If it is not taken, if it is not consulted from the doctor advice. How does this mifepristone and misoprostol will act? Okay. So remember mifepristone. So this is called as antiprogesterone or antagonist to progesterone. This is a antiprogestogen. So what's the use of progesterone hormone for pregnancy? We know progesterone will maintain the pregnancy, right? It will maintain the pregnancy how? By thickening the endometrium so that the whatever the implantation is happened, so they will be having good amount of nutrient supply, all that can happen. But mifepristone will sit on the progesterone receptors and it will not let the progesterone to bind to the receptors. One is that. So that's the reason why they are called as anti-progestogen. So when the progestogen cannot sit at the receptors, so endometrium thickening cannot happen. So when the endometrium thickening cannot happen, so implantation cannot happen well. Okay. So that's how mifepristone will helpful. Okay. So it will cause the lining of the uterus thin and it will detach the pregnancy. So remember, how does the mifepristone will act? It will prevent the implantation by normal thickening of the endometrium. Okay. And why do we use misoprostol? So, okay, implantation cannot happen, or implantation happened, but due to the mifepristone, it cannot maintain the thickness and it become thin. So, whatever the implanted is happened, it will detach from the uterus. Now, this embryo is lying in the uterus. It has to send out. So, there has to be a severe contractions to expel this mass from the uterus. So, that will be done by the misoprostol. So these misoprostol will act on the smooth muscles present in the myometrium. So they will trigger the contractions. So that contraction will expel this embryo out. So that we call it as the abortion by the pregnancy pills, abortion pills. Okay. So they can be effective 95% just before the first 50 days. After 50 days, the embryo is well developed. So even if the body is trying to expel out, some mass of the some mass will be just remain in the uterus. They have to be removed by surgically. That means through vagina, the doctor will insert a device or a vacuum chamber, and they will extract all these masses from the uterus so that there will be no infection can happen. But if women do this without advice of a doctor, some mass will be expelled out, but some mass will remain in the uterus, and that will cause an infection. That can also cause a cancer. Okay, so remember, sometimes they can also cause heavy bleedings and lead to death of the woman. So these are all should be done under the advice of a doctor or doctor's vision. Okay, so the combination is administered by a physician and is only used as a last resort if all the previous ones were failed. So mifepristone is a single pill treatment. It has very affinity to progesterone receptors. Okay, so remember this one. You can ask, why can't we use just a levonorgestrel? If the levonorgestrel is failed, then the only way is this one. This is a very strong affinity to the progesterone receptors. That means they will bind completely and will not let even the progesterone hormone to sit on there. So copper IUDs or emergency contraceptives prevent the implantation of the embryo. So if the IUDs is inserted by the doctor or trained nurse within the 5 days of the unprotected sex, so that will prevent the implantation. So we know the embryo has to develop so that after 3 days it will reach to the uterus for the implantation. So within that time period zone, we need to insert these copper IUDs so that implantation cannot happen. So finally, non-medicated IUDs, non-hormonal, female, long-term, reversible. Copper IUDs, these are also non-hormonal, used in the females, long-term, reversible. Hormonal IUDs, these are hormonal, the progesterone hormone, females, long-term, reversible. Okay. Understood? Is that clear?
Yes, sir.
Yes, sir.
Yes.
See, this much is not given.